The continued quest to find innovative surgical techniques has led to many great advances. Today, there are an increasing number of these options becoming available to more people.
Every 40 seconds, one person suffers a stroke, and it claims a life every 4 minutes. Stroke is now the #1 cause of long-term disability and the 4th leading cause of death. What is stroke? A disease that affects the arteries leading to and within the brain. The right actions can make a difference. There is real hope with prevention and treatment, but when stroke occurs, time is of the essence.
There are two types of stroke. There is either a bleeding stroke, formerly referred to as a hemorrhagic stroke, or there is an ischemic stroke. An ischemic stroke is interruption of blood flow to a portion of the brain that, if not treated in a timely fashion, is very likely to produce permanent injury to that part of the brain.
The American Stroke Association estimates that first-time strokes will grow from 16 million each year to 23 million by 2030. This life-threatening disease can be devastating, and every minute matters. But with rapid intervention, many can survive stroke and lead productive lives. Roberta Kaiser can attest to the importance of timing and treatment.
Well, fortunately, my daughter called me at 8:30 in the morning and woke me up. And I went to my computer and I was sitting there checking my email. And I got this terrible feeling that I couldn't move my body. And I couldn't, nothing was working right. And I threw up. And fortunately, the phone was right there, and I dialed 911.
This was a patient who came to the emergency room and very rapidly deteriorated to the point where she became paralyzed in all her limbs. She lost consciousness, she lost her ability to breathe, and she was well on her way to dying from an occlusion of her basal artery.
Know the warning signs of stroke: numbness or weakness of the face, arm, or leg, difficulty speaking or understanding, blurred vision or trouble seeing in one or both eyes, sudden or extremely severe headache, dizziness, confusion, or loss of balance and coordination. Any one of these signs may indicate an acute ischemic stroke. If you or someone you know exhibits one or more of these signs, call 911 immediately.
If we hadn't brought her right away to the cath lab and extracted this clot with the Trevo device and do it in such a rapid manner, she would have been left either devastated or dead.
The retrieval process is accessing the clot with a standard microcatheter and microwire. Once accessing the clot and passing the clot, the microwire is removed and the stentriver device is delivered through the microcatheter and deployed into the clot. Once it's deployed into the clot, it expands and integrates into the clot, and thereby facilitating removal by retracting the microcatheter and the stentriver device out of the vessel.
Stent retrievers for acute ischemic stroke have become more recently and widely available, and these devices now allow us to very rapidly and very predictably retrieve clot in the ability to treat patients with this particular kind of problem.
As approximately 87% of strokes are caused by a blood vessel blockage in the brain, and there have been limitations to the effectiveness of thrombolytic drugs, an alternative treatment has been needed.
The risks of waiting are that the longer the time from onset of symptoms to when the patient eventually sees medical attention, the more likely the patient is going to suffer irreversible damage to the brain and be left with permanent neurologic deficits and permanent functional deficits that will alter that person's life.
Getting the blood flowing again can mean the difference in survival and recovery, as Roberta Kaiser can attest. Technological advances like this will assist with the many challenges doctors face in treating stroke patients successfully. Rapid response at the onset of symptoms is key.
$700 to $800 million is spent on disability from stroke. So if we can affect that business quicker, then we can actually improve on the disability that's out there.
You know, I was always afraid of a stroke, and I was afraid that I would not be able to talk, that my body would never function correctly. I have friends who had a stroke and can't talk well to this day. So it was amazing that the therapy with the doctor's procedure, that I am normal and
Know the facts. 80% of strokes are avoidable. Take control of your health, but if you or a loved one shows symptoms of a stroke, there is hope. Quick response to get treatment saves lives like Roberta Kaiser's every year. With Trevo ProView, seeing is retrieving.